Sean, so I am your Jackson table guy and your Levo guy. This Levo is for your head positioning system, so it works as a skull clamp or your prone view mirror mask. So everything you have will be contained in these 4 drawers right here. So the first thing we're going to do is get the base unit for this. So you want to make sure everything is cleared off of the spine table. That includes your arm board brackets, and any prone view mirror mats that you have here. You want all this clear up until the chest pad. So first thing we're going to grab is the base unit, which is located in the 2nd drawer. So if you grab right here, and if you look, there is a silver piece on both sides. If I push this silver piece down, I can lift up on the blue piece. So I want to do it on both sides. I'm going to grab this up, I'm bring it all the way over. I'm going to put it on the band just like this. I'm going to slide it all the way up to the top. I'm going to let go of the blue pieces, and the silver pieces will lock into place. You'll hear it snap. The next piece we're going to need is your arm. Your arm is located in the top drawer right here, and this is what it looks like. So if you can see, there is a green dot right here. That represents the battery power. So this will go from green to red, or green to yellow to red. So if it's yellow or red, you want to make sure you plug it in, and the outlet, if you can see right here, know how this is covered, is right there. Plugged in like your iPhone. And the outlet is located in the drawer, right here. There we go. So you plug it in right here, and there's a plug in the back of the cart that you plug directly into the wall. Now, if you grab this out, and let's say no one plugged it in, and you're getting ready to do a case, and this is either yellow or red, fear not. You have another plug that you can plug this directly into the wall, into the arm, and you can use that for that case. So you have a backup one. So, this does have a battery obviously in it. It has all the components in it, so it is sensitive to fluid. So we want to make sure we protect it. So you guys have these bags you can put over them. So there's a large opening and a small opening. Large opening goes first, it goes all the way around and you wrap it. There's a small opening where this goes around. Once we have it complete like this, we can now take it, the arm, and put it on the base unit. So how we put it on the base unit, there's a hole right here. So we're going to take this, we're going to slide it right into the hole. You'll hear it click, and there's a blue locking handle right here that we're going to lock. Anything you see on this device that is light blue or dark blue in color represents a lock. So once that's established, we're set up and ready to go. So we need to determine, are we doing a spine case that's posterior cervical that requires a skull clamp, or are we doing a spine case that requires a prone view mirror mask? So for this first example, we're going to do it as a prone view, posterior cervical using the skull clamp. So the other device you're going to need is the handlebars. So if you go to the 3rd drawer, you'll see a set of handlebars. These simply slide on just like this, and then you lock it into place. Now you as the staff, you are done setting up. Everything else from here on out is physician driven. So, like I said before, anything that's light blue or dark blue represents a lock. So if I lift this lock up here, I can move this thing north and south. If I push this lock and unlock it, I can move this east and west. If I squeeze here with my fingers and here with my thumbs on all 4, I can go up, down, left, and right. If I were to squeeze my thumb here and my fingers here, I can do the same motion. I can go up, down, left, and right. So you have 2 different areas that you can do this. Now, once we have this set up, the patient comes in, they'll be anesthetized. You're going to take a skull clamp, and you kind of have to use your imagination here. So here's a patient with a skull clamp. You're going to take this adapter. This adapter is going to attach to the skull clamp. So it's going to go on, and it's going to look just like this. And here's the skull clamp, here's the patient. We're going to take the patient with the skull clamp and slide them over. This device is going to slide into this spot. What we want to do is we bring the patient here, we want to leave them here. We're going to bring the device to the patient. So how do we do that? Well, when you unlock this to give your north-south movement, and you unlock this to give your east-west movement, we have free range of motion. So the individual is going to be down here, they're going to squeeze with their fingers right here and their thumb right here, and we're going to slide it and get it right up to the patient. You'll hear it click, we let go, we lock our east-west, we lock our north-south, and now they're set up by locking this into position. Once this is locked, the surgeon can let go of the patient and they're locked into place. From here, they can make any type of subtle movements they want to get the patient in the correct position. Again, squeezing here and squeezing here. I can move left and right wherever I need to go, and the patient is set up. Okay, this is part 2 on how to drape the posterior cervical if you're using the skull clamp. So once you have the patient established and set up in the correct position, this is the drape that you're going to do. It is one solid drape from head to toe. So when we open this up, you're going to take the patient, there's an opening for the surgical site. We place it right there and stick it on. You're going to open up like a book, so it's going to open this way, and you'll see 2 directions. You're going to move it south, and you're going to move it north. And as you move it north, you're going to see 2 clear pieces that are condoms. They're going to slide over the handlebars. It's going to be clear also from here to here. So that gives the surgeon, if they need to do any intraoperative movements, they can do it without breaking the scrub. So all they're going to do is they're going to squeeze here, squeeze here, squeeze here, and they can make any type of movements they want to do, and then lock it in place. That